And good morning, everyone. For those that are members of the executive committee, to those that are turning in virtual, and to the one guest that we have here that has come in person, it's good to see you all. And thanks for all you're doing right now to see that we're moving forward with the work of the Mental Health Care Consortium. So we have a pretty short agenda today, but before we do that, we need to take the official roll, and we'll go through the roll, and then we will jump into the agenda. But let me turn the virtual podium over to Luann.
Good morning, everyone. I'm going to start roll call. Lakey.
Here.
Goodman.
Here.
Williams. Here. Liberzon.
Here.
Harper.
Here.
Wakefield. Here. Mitchell.
Here.
Thompson. Thompson. Martin.
Here.
Podewelz. Dr. Podewelz. Okay, Dr. Farmer.
Here.
Nimiroff.
Here.
Strakowski. Ton. Robert. Wagner.
Here.
Vo.
Here.
Suarez.
Here.
Babatope.
Here.
Liska.
Here.
Blader.
Here.
Chapa. Chapa. Patriarcha. Bryant.
Here.
Nichols.
Here.
Taminga. Ibrahim.
Here.
Schlacklin. Gaines. Sonia Gaines, I thought I saw you earlier.
Yes, I'm here. Can you hear me?
Yes, okay. Elizabeth Mayer. Okay. Martinez.
Here.
Keller. Keller. Castle.
Here.
Wesley.
Here.
Borges. I see you, Dr. Borges. Okay. Okay. All right, thank you.
It sounds like
Strakowski's joined.
Yeah, sorry, it's late.
Hi, good to see you.
it sounds like a couple of people are having difficulty joining by Zoom. So let me give some introductions, and hopefully they'll be able to join us before we start into the meat of this conversation. I think this is going to be a relatively short meeting. And again, I think we need to, the main objective of this meeting is to let you know where we are related to the plans on the ARPA funds. We have some slides to help tell that story and make sure that we're all on the same page related to the application process that we're going to be going through over the next several weeks, and get your approval for that. But that's all that we're going to be talking about today. We have our regular meeting coming up at the end of the month. Here in the room, in addition to the three that you can see, Luann, me, and David Lean, we also have Lachelle Inman. We also have Nagli Larian, and we have one guest from University of North Texas, Jessica Rangel. So welcome. It's good to have you here. So again, thank you all for being here. Hopefully soon we will be able to have meetings in person again. I miss the interaction and seeing everyone in person, but again, for right now, we are doing this by Zoom. So the goal again of this meeting is to give you the data related to what we received from you on the budget. And then we will need your approval on that. There may be some additional small tweaks that we will need to do as we do some final preparation to apply to the governor's office. But again, my hope is that we come out of this meeting with general approval and the ability to make a few small adjustments as we continue to work with the governor's office in the application process. With that, why don't we go ahead and start with put the slides up. We put together some information that will help us walk through this. Again, I want to thank everyone for providing your information on the budget. And I guess I also want to give a quick thanks to my team here. They have been working hard last night and this morning to put everything together. There were some institutions that needed some additional time to make some tweaks. And so there were some tweaks that were taking place this morning. And again, it won't surprise me if there may be some small adjustments that take place after this. But again, the goal of this meeting is that we get the general approval to move forward with the submittal of the application to the governor's office. So with that, why don't we go to the next slide? So I'm going to start off and give kind of the high level overview of where we are to make sure everyone is on the same page related to how we got here. And then Lachelle is going to walk through the specific budget numbers that we have received. But again, to make sure that everyone understands why we're having this meeting, not only the executive committee, but the other people that are listening in today. We want to thank the legislature for entrusting the Texas Mental Health Care Consortium during the 87th legislative session, the third special session, through Senate Bill 8 to do additional work to improve the lives of kids in the state of Texas, but also thank them for adding language that now allows us to work beyond just kids and provide services to pregnant women and women up to 1 year postpartum during the 2-year period of this act, which is in, again, Senate Bill 8. We have on this slide the way that the dollars are divvied up in the Section 8 of that bill. I won't read through those numbers, but they basically put monies into expanding and enhancing the things that we're doing right now. The Child Psychiatric Access Network, TCHATT, the Texas Child Access through Telemedicine, expanding the work that we're doing to work on the workforce in child and adolescent mental health services in Texas. There were dollars that were provided for these administration of these federal dollars. And again, thankful that this last line here was added, that out of the appropriation to the consortium, that we may use some of these dollars for the enhancement of the Child Psychiatric Access Network to improve perinatal mental health services in Texas. Again, I think that's something we've all been wanting to do, and now having the ability to do that really is fortunate for us, and we're thankful to be able to move forward on that front. On the next slide. Again, going through some information that comes straight from the legislation. And I'm going to read this verbatim, just so, again, we're all on the same page, that there is the ability to do some budget changes, and we're going to need to talk about that today. The consortium may transfer up to 10% of the monies appropriated for the purpose described in subsection. I'll let you read through that. For any other purposes described for those provisions. Basically, we're given authority to move up to 10% of the dollars. But it also says that the consortium may transfer more than 10% of the funds for those purposes only through the approval or prior approval for the transfer and expenditures from the LBB. And that process with the LBB, that a request for approval for transfer and expenditures by the consortium is considered approved unless the LBB issues a written disapproval for 10 business days upon the receipt and review of the request from the LBB. Again, the legislature wanted to make this streamlined. We gave them the best information we could prior to the legislative session, but again, a lot of work has taken place over the last about 5 months since the legislative session. And there are some changes, and this 10% rule will come into effect. And we will, it looks like we're going to need to notify the LBB about some of the budget changes that have taken place. And the process is that unless we hear back from the LBB that they're disapproved, that those changes will be approved. Let's go to the next slide. So, and actually, Luann, I might have you talk through this slide, but our team has been in conversation with the governor's office and the Higher Education Coordinating Board. They aren't handling us any different than they're handling all the funds in Senate Bill 8. There's been webinars, conversations with the governor's office that we've had recently to talk through how those dollars are received. But Luann, you want to give some detail related to how that is going to work for the state of Texas?
Sure. And before I do that, I'd like to recognize Dr. Potterwelts and Dr. Taminga as present. So as Dr. Lakey mentioned, the Texas Higher Education Coordinating Board will be the applicant to submit their application to the governor's office. That is due by February 28. We hope to have our information to the Higher Education Coordinating Board by this Friday or early next week so that they have time internally to review everything before the application goes in. The application does require that our budget is final and that we identify performance metrics associated with each one of the consortium's initiatives that will be funded. And Lachelle has been working with all of you on your metrics, and many of you have already submitted that information, and we appreciate that very much. We may have some follow-up conversations with you about that in the next couple of days just to get those finalized. The amount that we request cannot exceed the appropriation amounts that are listed in Senate Bill 8. And they will be provided to you on a cost reimbursement basis once the sub awards are issued. The responsibilities are going to be as follows, and this has to do with the responsibilities both for fiscal management and programmatic management. The Texas Higher Education Coordinating Board will be the recipient of the grant from the governor's office. They will enter into service agreements with University of Texas at Austin to serve as the fiscal agent for the appropriation, and the University of Texas System Administration in our role as the administrator of the consortium. UT System will serve as the administrative oversight entity. We will enter into service agreements with UT Austin and the coordinating board for their respective roles associated with fiscal management and the grantee responsibilities. We will be collecting status reports and your metrics from each of you as the health-related institutions, and we'll be responsible also for the evaluation of program performance. UT Austin, as I mentioned, will serve as a fiscal agent for the ARPA funds. In that particular role, they will develop contracts with each of you and the health-related institutions, as well as Meadows Mental Health Policy Institute for the Collaborative Care Initiative. They will be performing compliance roles and processes relating to the reimbursement requests that they receive from you. The HRIs and Meadows will be submitting fiscal reports and requests for cost reimbursement directly to the University of Texas at Austin. So this is a structural, just a look that's a visual that shows these roles and responsibilities that I just mentioned so that you can kind of see what it looks like visually. Does anybody have, can we go with questions right now? If anybody...
Let's take a couple of questions. Again, just to again, give you some additional detail of why we are doing it this way. And again, we are, again, following the rules that have been outlined for the state of Texas related to securing these funds. It is a grant, but it's not like somebody else can compete for these funds. It's just us because of the statute, that the way it's written, and we will provide that information. The governor's office wants to get the funds out to us so that we can move forward in these projects. But because these are federal dollars, there are steps that we have to jump through. The UT Austin, that's not Dell Medical School, and Steve Sterkowski and Charlie, I don't want to freak you out having UT Austin there. That's not you guys. This is a way that we can work with a very large grants management, sophisticated entity to get these funds out. There isn't the staff here at UT Austin, UT System. There aren't the staff at the Higher Education Coordinating Board because of the cost reimbursement. And so UT Austin will be that fiscal entity, fiscal agent for us in coordination with the Higher Education Coordinating Board to make sure that we do everything the way that it has to be done with these federal dollars. The dollars for administration, some of those dollars are going to be going to UT Austin for that management, and some of those dollars are going to be going to the Higher Education Coordinating Board so they can hire the people that are needed to make sure that we are following, again, the letter of the law with these federal dollars. So I see 3 hands, and I'm going to take them in order. Steve Plitzka, then Carol Tominga, and then Alex Vo. Steve, let me go with you first.
Quick question, which it may not be worked out yet, but do you anticipate, since we'll be sending in our metrics and then getting reimbursed for our cost, you anticipate doing that on a monthly or quarterly basis? I'm just thinking about planning ahead.
It should be on a monthly basis, Dr. Pliska.
Oh, that's good news.
Okay. Carol? Carol, you are on mute.
I would like, thanks for my question. I'd like a copy of this slide if that would be possible. Can you send these couple of first slides around to all of us?
I think they were sent out just a little bit ago. And again,
Oh, okay.
I would have liked to have gotten them out to you sooner, but again, we've been doing some budget changes even this morning as some institutions have changed their thoughts just a little bit. And so it should be in your email box. If you don't have it there, we will send it out again. Okay.
Thanks, David. Thank you.
Thank you, Carol. Alex?
Yeah, so it sounds like we're going to have a separate contract with UT Austin. Would there also be a separate BAA with them as well? Can you answer that so I can prepare my institution for that?
Do you know, Michelle?
I'll have to think about it. I don't believe that you're going to be sharing any kind of sensitive information with them. All of the programmatic information remains with UT System and with the Kosh.
Okay. All right. And if anything changes, we will let you know that. Again, we're working closely with them to make sure we do this in accordance. If that changes, we will let you know. Okay. Steve Strakowski?
This is just an offer. UT Austin is a wonderful institution that's sometimes difficult to get contract and this work done. If it's helpful to you, if you can let me know who your contact people or person is, I can maybe help coordinate that.
Okay, very, very good. You want to
Sure.
talk through the how that's working and the
Yeah.
people that are going to be involved?
Dr. Strakowski, we actually invited the UT Austin team to participate this morning, but I don't see that they've joined. I do want you to know that Elizabeth Mayer has joined from the Texas Higher Education Coordinating Board. So welcome, Ms. Mayer. We're glad to have you here, taking Stacy Silverman's place on the consortium. The 2 individuals at UT Austin will be Renee Gonzalez and Linda Haster.
Okay,
So-
good. That's helpful. We work with Renee quite a bit, so that's good. Okay, let me know if we can be helpful from our own grants management office in the med school.
Thank you. We appreciate that very much, Dr. Strakowski.
Yeah, UT Austin, Renee and her team have been really helpful as we've worked through these conversations, and very excited about being part of this. And so they do this kind of work day in and day out with large amounts of money. And so this will flow into their workflow pretty readily. And again, we'll be able to use some of the dollars that were provided for administration to offset their costs that they will provide, that they'll have to have dedicated staff to do this work.
No, you landed in the right place. That's what I wanted to check. So wonderful.
Very good. Thanks. Any other questions? If not, let's go to the next slide. Okay.
All right.
Michelle, you want to take this slide, the next several?
Sure. So as Dr. Lakey alluded to, we've been collecting information from each of the HRIs and Meadows regarding their participation in the various projects were identified in the fall. Everyone's had an opportunity to reassess their budgets. They've submitted new budget templates, and there is a variance between what was originally submitted and what we're seeing today, as we talked about earlier. The final budgets have been consolidated by those three major categories that we talked about at the beginning. So I'm going to start with the CPAN expansions and enhancements. And this slide just lists the various projects that everyone will be participating and which of the HRIs will be participating and what those budget line items are. At this moment in time, the consolidated amount for CPAN enhancements and expansions is at $28,463,940. We did have quite a lot of people choose to participate in the additional consults. These are direct services to providers that are enrolled in CPAN. Baylor will be setting up a direct messaging and text add-on feature using Lantana and Trait, our two technology providers. The costs there are minimal. Most of those costs will be held by Baylor College of Medicine as the COSH. Pediatric Collaborative Care is the initiative that Meadows will be leading, and that $7 million will go to Meadows, and then they will have agreements with the participating institutions. So those funds will trickle down. The perinatal CPAN has 4 institutions participating, and that is currently at $6.9 million. And then the FISP Zero Suicide Echo is at $5.5 million.
So let's let that just sit there for a second, and would ask all the executive committee members just to take a quick look at that. And if your institution isn't listed there as being a participant, let us know right away and we'll make the adjustments. But this is based on all the information that you have provided us. So we'll give you 30 seconds to look through that. All right, let's go to the next slide.
Dr. Wakefield, you had a question?
I did. TCHATT had said that we did want to participate in CPAN text add-on, but we did not think that we needed additional funds outside of what was going to the COSH.
Okay. So you know, good point. A lot of institutions have decided to be part of this, but could do some things within their internal budget. That's not necessarily reflected on this slide, which is showing where the money is going. But we can make that as make that point as we apply for the funds.
That's the same issue with UTMB.
Okay, very good.
And Texas A&M.
And UNTHSC.
Yeah, okay, very good.
Yeah, one point at least was discussed in the in this when we got all this is that that those additional funds were for administrative costs on direct consults, not for additional child psychiatry time. So people are worried. I mean, I think the thinking was, and if we want to go back and review that, that's fine. The thinking was that CPAN was originally funded under the assumption that certain numbers of direct consults would be done. And so I think we didn't include additional child psych time. Yep. And I'm assuming that's going to be applied across the HRIs, you know, one way or the other.
Yeah, it's a good point. What this slide shows is where the funds are going. But as you are noting that many institutions are adjusting their programs to meet these needs without the need for additional funds. And we'll make sure that we try to capture that information. Okay. Let's go to the next slide.
All right, the next slide is around TCHATT enhancements and expansion. The sum came up to $61,076,770. We had 7 institutions that elected to participate in the additional sessions as needed. And this is to provide additional sessions to students that require them at the schools that we are working with. That came to $6 million. We had 5 institutions that are seeking to expand their TCHATT regions. That is the largest chunk of funds here at $16,640,745. The suicide prevention YAM that's being led by UT Southwestern It has 8 institutions that are participating at 11 million. TCHATT Bilingual Trauma, UT Health San Antonio will be rolling out that initiative. And then the next one, the evidence-based face-to-face telehealth groups, Texas Tech at 5 million. TCHATT CPAN anxiety services, we have 3 at 2.2 million. Trauma-focused expansion, 6 institutions at 10.4. The youth substance use disorder expansion, 5 institutions at 6.1. And then the technology costs to support all of these ARPA projects. And again, that's to collect the data and enable us to track the different services that are on offer.
So again, we'll take about 30 seconds here and or more if needed, and would ask you to take a look at this. And if you're not included, especially related to budget funds coming to you for this, would ask you to let us know.
So David, I assume the contract between UT Austin and us, the HRIs, will reflect deliverables as part of things that we are and are not involved with, right?
Yeah, it'll be specific for your institution. And we will be working to, UT System still provides that oversight. They are the fiscal agent. They will be providing a lot of that work on our behalf, but there will be close collaboration there.
And
Dr.
I'm good.
Okay, Steve, I don't see your hand, but go ahead.
Oh, sorry. So on the pediatric collaborative care, will we be contracting directly with Meadows, or does Meadow, how's that funds flow going to run?
Yes, the funds will go to Meadows and then Meadows will contract with you.
Okay, so we should be looking to hear from Meadows I've had some very preliminary discussions, but haven't gone very far with that. So I assume they will be contacting us once they get the funds or when they're close to getting the funds.
Yes. Along those lines, I want to thank the folks that have helped us put these different projects together. Joe Blader, Dr. Blader has been very helpful in the substance use initiative. We've been working on the perinatal work that was on the previous slide. Those meetings have already been taking place on a regular basis to make sure we get a jump start as soon as the funds are available. So again, thanks everyone for the work that you've been putting in on these committees to get us ready to move as quickly as we can with these projects. All right, let's go to the next slide.
All right, the last slide is around the mental health workforce expansion. We have 3 different initiatives, the LMHA telehealth services, where we've got 6 institutions that have elected to expand the telehealth services that they've got going on at 9.1 million. The LPC, LCSW, NP training, there's a variety of different training opportunities. It does vary by institution, but the purpose is to increase the number of mental health providers in Texas. And we've got 5 institutions participating in that at 5.1 million. And then finally, the additional child fellows, child practicum for psychology grad students, and the child and adolescent psychology internships. 6 institutions are participating at 4.9 million for a total of 19,207,331.
Laurel, I see your hand. Dr. Williams?
Yeah, Baylor's participating in the last one.
Okay.
Sorry, I know there's been so many budgets floating around, but
we'll get you added.
I'll get you after this meeting.
Okay, very good. Any other adjustments? All right. Let's go to the next slide.
Sorry. So this last slide just shows how the budget is being allocated across the different institutions. So we've got a percentage. Obviously, Texas Tech is getting the majority. They have chosen to participate in almost everything that was on the board for selection. So they've got a lot of work to do, but I know they're excited to make some changes in their region. Overall, you can see we're hovering around 6% for most of the institutions participating, a couple under and over.
And I guess the other, just to set the stage for this slide, is we've put in everything that other institutions have asked. We haven't cut any institution. The budget that the legislature put in place was based on the ask and the needs of institutions. There have been a couple of institutions that back in October, September, October, thought they would be able to participate in certain items. They have decided on their own that they shouldn't participate in those at this time, or and have decreased some of those asks. But for all the institutions, what you've asked for, we have been able to put into this overall budget that we will be describing today. Okay.
So last slide just compares what was approved by the LBB versus what our final budget numbers are looking like. For CPAN enhancements, we're currently showing to be 38% higher. However, that does include the perinatal services, and the way that the legislation was written, it sounded like those would come out of our overall funds. So if we were to remove the perinatal services, we're actually at only 5% higher. But it belongs under that sort of psychiatry access network category. So we've placed it there for now. TCHATT enhancements and expansion is 9% higher. It's within that 10% mark. And then our workforce expansion is 42% lower than what we originally projected. Administration costs remain the same. So overall, right now, we have just a little over $1 million that has not been allocated.
So Dr. Williams, this will get to that issue that you raised just a little bit ago. We're going to need to make sure that we have, if there's some additional dollars there that need to be put into the budget, that we've identified those and put them in. But with our conversations with institutions and our best understanding right now, we're at 112. Again, the upper limit we have is 113. We will plan, if the executive committee is okay with it, to make some additional tweaks, because I want to get as close to that 113.082 as I can. But right now, based on the information that we've received, we're at 112. The other, again, item to highlight is looking at the letter of the statute. We are above that 10%. Again, we can make the case that the reason that CPAN is that much higher is because of the perinatal mental health work that we were authorized to do. And there wasn't a line item for it. And we would categorize that as part of CPAN. But again, to make sure that the LBB and the governor's office is fully aware and we're being as transparent as possible, we will provide this information to the LBB and then follow that, if that legislation, that if it's not disapproved in 10 days, we will assume that it's approved and then move forward. Okay. Any questions?
I would suggest maybe on that slide, maybe that CPAN enhancement, you divide that line and show the perinatal broken out by the number. Okay. So then you would have, 3% higher for CPAN and then no percent number for the perinatal. It would kind of just make, I'm just thinking of guys at the LBB or women at the LBB looking at a slide right off. You don't want them, it biases people when they look at a slide and see one thing. If it's clear to them right from the get-go, you have a smoother way to go.
That's smart, Steve. And we'll see if we can break it out that way and craft the story as we give it to the LBB. Danette, I see your hand.
Yeah, I would like some conversation about the 42% reduction in the CPWE program. That's a substantial reduction, and I haven't been engaged in conversations that would have kind of warned me that that kind of a reduction was going to happen. So I'd be interested in the rationale for that.
Our rationale is basically what we've put in, what the institutions have asked, based on what they think that they can do at this time. If there's any of our institutions that would like to comment on that, again, I would welcome that. Sarah, I see your hand. Do you want to talk about Danette's question or another issue?
Yes, Danette's question. So Danette, I know in our area, we had more in our CPW budget, and now it's falling under TCHATT, expansion of evidence-based groups and some other therapies and trauma. But our plan is that those LMHAs still will have access to those programs, but administratively, it made more sense to put that under the actual clinical based programs. So we are still planning to provide the same amount of services. It's just allocated in different budgets.
So allocated in different budgets from the standpoint of kind of pulling some funds back from expanding the workforce through the residency program and more into your clinical engagement. Am I following that?
So we have put in under our clinical budgets, we've put additional postdocs and MSWs and LPCs throughout those budgets that will fund expanding the workforce.
I think we're not actually cutting it. We're all maintaining our CPW programs that we're already into. Just some HRIs elected to go into further expansions and others did not for probably each for individual reasons as sort of Sarah's alluding.
Okay.
In our case, we felt like, we bid off a lot with the 3 LMHAs we're working with. We got a lot of work to do with them to make the program work. So we didn't see ourselves in the position of, we already have 12 caps to expand to 15 caps or 16 caps just wasn't, and start up with all new LMHAs when we're feeling our way with the current one. We just didn't see it as practical. So we didn't apply this, for these, particularly the issue here with 2 years, and funding going away in 2 years. But with the ARPA money was probably another barrier.
So that barrier probably makes more sense, but that also creates concerns for much of the other expansion, I would think. I just know there were a number of sites, just even as you talked there, Dr. Pliska, who had indicated interest, and we had actually built this up and supported this from the standpoint of anticipating that once approval for these funds came, we could see opportunity for other areas that are not currently participating. So that's just a reduction that was unexpected. Larger.
Well, not a reduction. You're increasing by $20 million.
I understand.
That's going to be a lot of caps. Let me tell you.
let me correct Dr. Pliska, because I totally understand the point. It's not a cut in the current program. It is a reduction in the funding that was anticipated, and it's a substantial reduction in the funding that was anticipated to be above what is currently out there. So, I'll cut the conversation off there, but just say that, I hope that we'll see continued investment in this. We have a number of local mental health authorities that are interested in participation, especially as we gain experience in, many areas of the state. So I think it's a fair question for me to ask when I see a change that is 42% from what had been projected initially. And a fair conversation for us to have during the deliberations of the executive committee.
It's totally fair, Danette. I appreciate you bringing it up, and again, a lot of opportunity there in the future. And again, don't feel hesitant at all about bringing those issues up. Thank you, Danette.
I just want to add that I did get Baylor's budget just now for that expansion of. So that is going to increase that CPW percentage. So I'll try to get that added.
Okay. So it'll increase some, but Danette's point is still valid that it's not nearly as much growth as was anticipated in September based on where institutions landed. So again, thanks, Danette. Let me go to Carol and then to Israel. Carol?
So I'm really glad that you brought up this point, Danette. Because I think it deserves at another time, David, some more lengthy discussion. And of course, Steve Pliska would head this up, but it's been much more difficult than I had anticipated to put people into community mental health centers. And we lagged a little bit because where we went first didn't work very well, and we had to pull back and find new places. And we have found new places, and we have new ideas now. And so we had some money left over from last year, so couldn't quite use as much. If there are ways that we could share experience across the sites here, I would find that very useful. And Steve, maybe you want to head up some request for doing this sometime. It's off topic for today, but
Yeah,
I think that
the
it's a
next
really
CPE
good point, really good point.
The next CPE operations committee, we can look at that. I mean, and again, there was no, to emphasize the way all the HRIs were given the menu and everybody on their own sort of said, we'll do this, we'll do that. And there was no decision that we were going to do less CPE or request less of a increase in CPE. That's simply the way at this point it is wound up. And
I think that we could all use the advice of Danette, really, and really the opportunity of doing that here at this meeting sometime, David, in the future.
So along those lines, I guess what I would suggest is we probably can't build it into the agenda in February, but in our next meeting, let's craft out a specific section of kind of lessons learned. Who's doing this well? How do we share some of those best practices? And maybe what are some of those additional opportunities from Danette's position, getting information from the Texas Council and the local mental health authorities, or where they see some opportunity to help craft our thoughts of how do we move this forward and position for the next session.
And then also recognizing that we launched this program in a pandemic.
Absolutely.
That
Absolutely.
So many challenges, and we do not want to lose. This is one of the core reasons that brought our support for the whole TCMHCC, and really recognizing our ability to strengthen the relationships with the HRIs and to really be able to build that workforce out. It's hard work. And it takes continued effort. And I appreciate Carol's comments on this and look forward to working with Dr. Pliska, continuing to work with him in terms of ensuring that we really build this out in a way that helps us around the workforce issues that we have faced for a long time in psychiatry, in particular, other professionals as well.
Very good. Dr. Liberzon?
Well, some of what I wanted to say was said, but just to add to this discussion, I think it's an important point. I think Steve made a couple of important points as well. It's we need to think very carefully. So one thing is we would not ask, after discussions, we'll not ask any monies that we don't think we can use. So that's an important point that was highlighted to us several times. So we are trying to be conservative in a way that we request enhancement of funds, to be sure, have a kind of a strong feeling that yes, we'll be able to actually do it. Second point, what Steve was mentioning, which is critical, when we talk about enhancement of workforce, and we're talking about ARPA monies, which are time limited, we need to think what happens after those 2 years. And that's a critical component to us, because without it, MHMRs also will have a problem to maintain individuals and so on. So we're not sure how to deal with some of those issues. And if we are planning on approaching that, we really need to think about what we're going to think about this problem when the money runs out. And that's a problematic, because when the money is planned for activities, you can cut down activities. When money, most of it planned for the position, you cannot, I mean, you either need to cut down the position or do something. So that's, in my mind, requires a little bit different approach than enhancing or planning for particular programs. And the third point that I wanted to make is that it's really different for different HRIs. For us to recruit into mid kind of central Texas area for MHMRs is extremely difficult. It requires, and we didn't ever use that, but I'm paying, to the search firms about $30,000 a year for each individual that they bring me in, and I do use search firms. it's really difficult around the country to go on and to attract individuals and bring them in. And I'm not sure whether even those funds can be recouped in any way or not. So I think it's just unequal because some places a little bit easier. MHMRs are difficult in general, but also geography compounds this issue. And geography requests additional funds. So to me, I think it's a very important discussion that Annette has brought up, and I just wanted to add some of my thoughts. And we are struggling with that. That's not a simple question for us. We would love to have more people in MHMR. Would love to have MHMR expanding the services as much as we can. But I think it requires kind of a serious planning. Thank you.
Thanks, Israel. I think those are good points. The other thing that I have heard, and Lachelle just pointed out to me again, is that the time frame for the arrival of these ARPA funds aren't necessarily in sync with recruitment of residents and a variety of other things, which made it a little bit harder as this time got pushed back related to the arrival of the funds. So again, I think all of you are trying as best you can, knowing the local challenges you have, and I think there will be benefit to come this spring in one of these meetings to share best practices. How are we partnering? And Danette, the work that you've done looking at what other local mental health authorities would be interested in developing these type of partnerships. So again, thank you. Any other issues? Okay. So what I think, the way that that we think that we can move forward is if we have a motion today to give us the authority to move forward with this basic budget, understanding that there will be some additional tweaks that may occur as we get some other fine tuning of some budgets. Again, trying to make sure that we hit that 113 mark the closest we can. And so if there is any member of the executive committee. So moved.
Second.
Okay, I have an Alex Vo motion and a second by about 3 different people.
This is Isham Ibrahim, if you want to take mine.
All right, we'll take yours. All right. Any further discussion? Hearing none, why don't we do this as a voice vote of the executive committee members, since it's an important vote. And I'll have Luann go through the roster for the vote. Thank you.
Okay, Lakey,
Approve.
Goodman,
Approved.
Williams,
Approved.
Liberzon,
Aye.
Harper,
Approved.
Wakefield,
Approved.
Mitchell,
Approved.
Martin,
Approved.
Potterwills,
Approved.
Farmer,
Approved.
Nimiroff,
Approved.
Burkowski,
Approve.
Wagner,
Approved.
Vo,
Approved.
Suarez,
Approved.
Bobatrope,
Approved.
Liska,
Approved?
Blader,
Vote to approve.
Blader,
Did you not hear me? Vote to approve?
okay, Bryant,
Approve.
Nichols,
Approve.
Taminga,
Approve.
Ibrahim,
Approved.
Gaines,
Approve.
Mayor,
Approve.
Martinez, Dr. Martinez, are you still there? Okay. Castle,
Approve.
Wesley, Dr. Wesley, are you still there? Okay. Borges, okay. Just left.
Names that we didn't get, so I see a couple of the people that we called I see you on the camera, or I see your name on the camera.
Who did I miss?
Danelle Wesley, did you vote?
No.
She may have had to step away. Okay. All right, very good. And
I did not vote, David, but I'm assuming that's because I'm replacing Steve and Steve hasn't rotated off yet.
yeah, that's exactly right. So Jeff will be coming
Okay.
on to replace Steve Strakowski. Steve Strakowski will be moving to his new position, and with that, Jeff, you'll be coming in. Okay.
And I do see Dr. Borges, but I did not hear an approval. Dr. Borges.
Approved. He's waving his
Okay,
hand.
he's
Approved.
waving.
Okay. All right.
This is Dr. Chapa, and I just got the link, and I don't know if I was called either.
Okay, Dr. Chapa, we're voting on approval of the budget.
Okay, I approve, yes.
Okay. All right.
Oh, and there's Dr. Martinez. Dr. Martinez, we're voting on the budget.
Sorry, my head's up just a sec for a phone call, but yes, I approve.
Okay,
Very
thank
good.
you.
All right. So very good. So again, our next steps are we're going to do a few little refinements based on some input and then package this in the way that the Higher Education Coordinating Board needs it to be packaged to be sent into the governor's office. At the same time, we will craft the way that we will send it to the LBB and follow their the guidance that's in the bill related to the changes in the budget. And again, in our subsequent, we'll have our next meeting on February 28th to go through the work of the rest of the consortium of what the work that we're doing. And then in the following meeting, I think having a specific dedicated component of that on how we can be more productive in working with the local mental health authorities, and then the workforce development component will be critical. Okay. Any other comments related to the meeting today or business that we need to discuss? So on the Nagla, you want to? Okay. So I guess the other thing I want to say is, I appreciate everyone. The other thing I was going to say, again, we really appreciate everyone working on the variety of programs. The substance use initiative seems to be taking shape well. And again, I appreciate all the work there. The perinatal group, again, want to really thank the institutions that are participating in the pilot. Again, we want to make sure that we move forward very quickly in this pilot and get all the information we need for the next session. We have been working on about a weekly basis with Tradent to make sure that we craft the IT component of this the way that we need to so we can get the jump start. There will be a teaching component of it to improve the overall ability of other institutions to move forward in this work. There was a selection of Dr. Wakefield to be the medical director, but all the institutions are going to have a critical role in crafting this to make sure that we tap into all the expertise across our institutions to make sure we develop this to be, again, a great model of how we can move forward in this area. Any other comments about anything else related to the consortium's work? Hearing none. Luann, did you have anything else?
Well, I was just going to say, for the record, I see that Danielle Wesley is back. You were not present during the vote, but I wanted to record your vote on the budget.
Support and approve. Thank you.
Okay,
Very good.
thank you.
All right. So with that, let us close this meeting, and we'll give you an hour of your time back to catch up on all the other stuff that you're doing. And again, appreciate all the work that you're doing to improve the health of kids in the state of Texas. Thank you.
Thank you all.
Thanks.